My e-poster is titled A Cost-Effective Non-Human Parotid Gland Ultrasound Model for Practicing Pathology Scans in an Educational Setting. I have no disclosures to report. For an introduction, ultrasound is an effective and non-invasive means of diagnosing and classifying pathologies and guiding management. Specifically, ultrasound of the head and neck is a technical skill that is not often introduced to students in the course of medical education. Some barriers to introducing this technique to medical students include the cost of commercial models, which can often run in excess of $1,000, as well as finding human subjects with pathologies to scan. Our goal with this project was to create a parotid gland model that mimicked normal anatomy, modeled various pathologies, and was cost effective, most importantly. Our methods included a literature review to determine the most common pathologies. We decided to model parotid gland calcification specifically. We tested a number of different materials to find an anatomic match, both in terms of ease of use with the ultrasound machine, as well as whether or not it was representative of actual pathology in human patients. After multiple trials of each model using the M mode to ensure that our setup could withstand repeated scans without compromising the image quality, we settled on a final gland representation on ultrasound. And then we went ahead and compared our images of the model to true pathology that we found through our literature review. Our results showed no prior literature on cost-effective salivary gland models, including specifically the parotid gland. But our literature search included all salivary gland models, and we were unable to find a non-commercial model that had proven to be representative of actual pathology on ultrasound. Our model was comprised of the following components. Number one, an opaque nitrile glove finger was filled with 15 cc's of water and tied off with suture. Drywall spackle was molded into a calcification and inserted into the finger after it was allowed to dry. A plastic clothes hanger was cut to approximate the angle of the mandible, and the entire apparatus was placed inside a plastic tub and covered with gel. And the goal with the components of our model was to make it out of things that were easy to find um, around the house or um, on the medical school campus or in a hospital, things that were relatively cheap, easy to access, and easy to build into a working um, and representative model. So those are the four components of our model. Each setup was tested at least 10 times to ensure that the image could withstand repeated scans without compromising quality. Our goal was to have a model used repeatedly by different medical students, and we wanted to ensure that repeated scans would not compromise the image quality or alter the pathology in any way. And finally, our ultrasound image did compare favorably to actual pathologic imaging on real patients. And that was one of the most important outcomes for us, was ensuring that our ultrasound images were actually representative and that these medical students were getting an accurate image of what they would see as a practicing clinician doing ultrasound of the head and neck. Here are some images from our model. So on the top left and the top right are two different images of two of our models. You can see the calcifications made out of the spackle paint there in the center of each model. The gland is the hypoechoic structure on either side. And then you can see the mandible is the hyperechoic structure in the inferior portion of the gland, which again is representative of the actual anatomic layout. On the bottom is a picture of the real life model. You can see the nitrile glove representing the parotid gland. Within the glove is 15 cc's of water, as well as a spackle paint calcification inside the glove. And then we have the plastic clothes hanger that was cut into the shape of the mandible, and the parotid gland is resting at the angle of the mandible, such as it does on a human in human pathology. The entire apparatus was covered in ultrasound gel for ease of scanning and placed inside a plastic tub for easy setup and breakdown. And so here are the various components of our model. In comparing our ultrasound model to that of a human patient, you can see here on this slide that it does compare favorably. The gland itself is relatively hypoechoic, as you can see both on the left and on the right. So the left is a real human patient pathologic specimen, and the right is our representative image from our ultrasound model. So you can see that the gland is hypoechoic, and then in the inferior portion, so in the far field of both images, you can see a calcification within the gland. So in the human patient, the calcification appears hyperechoic, resting in the far field, the inferior portion of the gland. In our ultrasound model, again, the calcification, although somewhat larger for ease of scanning for our medical students, the calcification still rests in the inferior portion, appears hyperechoic, and does have that irregular border consistent with pathologic calcifications within the gland. As you can see on our image as well, might be hard to make out, but we were able to utilize measurements within the ultrasound machine to measure the depth of the calcification, the height and length of the calcification itself, and ask students to report that data to us as well. So our model did compare favorably to representative human pathologic images of parotid calcifications, and the cost to build each of these models, including the calcification and the cyst, was less than $1. Again, comparing that to in excess of $1,000 or more for commercially produced models. Conclusion and future directions for this abstract, for this study. Our model allowed medical students the ability to hone diagnostic ultrasound techniques of the head and neck without requiring significant financial investment or the recruitment of patients with parotid disease. So in both of those aspects, our model provides access to students both to scan from a financial standpoint as well as from a access to pathology standpoint, so not having to have patients recruited for scanning. These models are easy to build in the home or in the hospital on a medical school campus with readily available materials. And so we hope that with models similar to this, moving forward, the access to scanning for these types of pathologies can increase. We plan to apply this model to other disorders of the head and neck, including thyroid nodules and soft tissue masses. The nitrile glove setup filled with water we found to be a great representation of cystic lesions as well as other salivary glands. And so taking that setup and applying it to other disorders of the head and neck should prove fruitful for future studies. Finally, we plan to compare this model side by side to a commercially available model to determine its effectiveness in educating medical students on ultrasound of salivary gland pathology. The ultimate goal with this model is to prove definitively through an additional research study that this model does stand up both in terms of quality, reproducibility to those commercially available models, with the end goal of making instructions for creating this model widely available so that access to ultrasound scanning of the head and neck can be made more available to medical students across the country. That is all I have. I appreciate you viewing this e-poster. I thank you, and my contact information is listed below.